What America cares about is this. There are over 1 million Americans who go broke every single year trying to pay their health care bills. America cares a lot about that. America cares about the fact that there are 44,780 Americans who die every single year on account of not having health care. That's 122 every day. America cares about the fact that if you have a pre-existing condition, even if you have health insurance, it's not covered. America cares about the fact that you can get all the health care you need as long as you don't need any. We have to remember that what's at stake here is life and death, enormous amounts of money, and people are counting upon us to move ahead. Last week I held up this report here and I pointed out that in America there's 44,789 Americans who die every year according to this Harvard report published in a peer-reviewed journal because they have no health insurance. That's an extra 44,789 Americans who die whose lives could be saved.
Will set up its massive clinic in an exhibit hall for a weekend in Knoxville, Tennessee. Tools for dentists were laid out by the yard. Optometrists prepared to make hundreds of pairs of glasses. General medical doctors set up for whatever might come through the door. Nearly everything is donated. Everyone is a volunteer. The care is free, but no one could say how many patients might show up. People in pain didn't want a chance being left out.
Who's got number one? Come on down. 3.
Inside, 276 volunteers from 11 states were waiting.
Are you here for medical, dental, or vision?
Ross Isaacs is one of the doctors.
Who are these patients?
It's the working poor, middle of their lives, most with families, most not substance abusers, and employed without adequate insurance.
Dr. Isaacs saw Marty Tankersley, the man we met in the parking lot who'd driven 200 miles. It turned out that Tankersley a few years back had 2 heart attacks and heart surgery, but almost no follow-up since.
So you haven't seen somebody in a while with regards to your ticker and stuff.
The Tankersleys live in Dalton, Georgia. They fall in the category of the underinsured. Marty's a truck driver. He has major medical insurance through his employer, but the deductible is $500, really unaffordable. And the dental insurance costs too much. No one really knows just how many Americans are underinsured, like the Tankersleys.
He's the lucky one that could drive the 200 miles. He's the lucky one that got to see people today and get hooked in. There are tens of hundreds of thousands of people like him.
Marty, his wife, and daughter were seen for checkups, glasses, mammograms, and the yanking of that agonizing tooth.
This has truly been a godsend to us, to me and my family, and to all the hundreds of people that's here. I see the faces, the relief in the faces. This has been a wonderful thing.
The next day, Sunday, there were hundreds more. Tickets started again with the number 1, but now the doctors were racing time. In hours, they'd be headed home.
Really glad that you came in, especially given...
Nurse practitioner Teresa Gardner was worried about Rebecca McWilliams. McWilliams had surgery for cervical cancer in 2005, but without the recommended follow-up.
How long has it been?
It's been about 2 years since I've had my last pap smear, and I was supposed to have every 6 months, and I've really only had it once since that surgery.
You know, I think many doctors would say you've taken a terrible risk.
Yeah.
Waiting this long.
I really have, but it's just, like I said, it's very hard to afford it. I have 3 kids, and My husband lost his job this past summer.
McWilliams' pap smear came back clear, but in her exam, Gardner found reason to worry.
I think just from, the clinical inspection of the cervix that, possibly there is a possibility of that cancer, still being there.
She was 28 years old.
28 years old, the mother of 3.
She's retired, living on disability with no insurance, and her glasses don't work anymore. She got in, only to find out that the vision care line had closed.
How is your vision?
I bet in my left eye it's probably, I couldn't see your face. The Lord will take care of me. The Lord will provide. The Lord will provide.
But not today.
But not today.
But at the gate, many were waiting when the weekend ended.
And now the task is to see whether we can do all 1,500 here today with dentistry, vision care, general medical treatment, etc. The limiting factor is how many volunteer practitioners do we have here today to provide the care.
A couple of groups got together, both the California Nurses Association and California Physicians Alliance.
Most of these people are either still working without insurance or they were recently laid off in the last year.
And I saw a woman around 5:30 this morning. She's about 77 years old. She had goop coming out of her eye. She had a cane. She'd walked 3 blocks from a bus, and she was looking to get health care. And the desk told her that they were out of tickets for the day.
We've been here since 4.
4 in the morning.
4 this morning.
And you got a ticket.
We got a ticket. And the ticket's $10.95. And we thought we were here early.
Basically, we've seen people being carried in, and if they'd had access to care, they wouldn't be here, and it's just such a shame in the second largest city in the United States.
Now, as you can see from the video clips, we're facing a huge problem. And this isn't in some third world country, this is in America, in your own backyard. And we got to do something about it, because right now there's no solution in sight. So we're taking action. One of the things that we're doing is we're partnering with a worldwide humanitarian organization called Global Flying Hospitals. And what they do is they provide logistics and resources to people in developing countries all across the world that don't have access to health care. Now, one of the things that they're going to be doing in the first part of 2010 is they're launching what's called the Health for America initiative. And Health for America is a multi-city tour where Global Flying Hospitals will be providing free healthcare services to those that don't have access to it. So that's dental, vision, and preventative care services to those that are underinsured and uninsured in cities all across America. A beautiful thing for people that are suffering right now, that are definitely in need. Now, one of the things that you can do to help us out and to help us reach as many people in as many cities as possible is by donating. You can donate $10 by simply texting the letters GFH to the numbers 85944. Again, text the letters GFH to the numbers 85944 to donate $10 for this cause. What will happen is you'll receive a text message back asking you to confirm your donation. Make sure to reply yes, and then you'll see the $10 charge in your phone bill the next time it comes. So that's what we're asking for. We're asking you to show us your Sundance. Well, what does that really mean? It's our mantra for this campaign for the Sundance King. Now, what it means, what Sundance means, is that you're actually making a personal sacrifice for the good of the community and the good of yourself. Now, show us your Sundance by donating $10 or donating an amount more than that, and also by spreading the word. Now, we've put together this blog so you can find out more information about Health for America, about the Sundance King, about Global Flying Hospitals, and all that we're offering here. So make sure to take the time to look at this information, and most importantly, spread it amongst your friends and your family. It is very, very important that people understand that they have a solution out there. They have help. They have help for the problems that they're facing. So spread it out to as many people as possible, because we need it, and we need your help.
So thank you very much. Show us your Sundance. Visit our blog, check out all this information, and have a great day.